everybody. My name is Gregory Robinson. I'm a PhD candidate at the University of Lethbridge. I'm also an MBA candidate at the University of Illinois. And we're joined here with Alyssa, who's an undergrad at the University of Lethbridge that's about to start her MD at University of Calgary, and Carol, an MD candidate at the University of Alberta. And we're representing MICOS, which is a student-run organization that's operated out of the University of Lethbridge. Our objectives are to enable patients to take steps to improve their own lives with nutraceuticals. We want to create novel formulations to target common health problems that are very relevant today and improve outcomes specifically for obesity, diabetes, and erectile dysfunction. And we're doing this by utilizing mushroom extracts. And this is our hypothesis, that we can use these mushroom extracts to create novel formulations and use this to improve people's lives. So the history of mushrooms can date back even to ancient Egypt. They are believed to be a gift from Osiris, and they were used by pharaohs for immortality. In ancient Greece, they were used by warriors to provide power before going into war, and they were used in the Roman Empire for ceremonies, and they're believed to be food of the gods. But most importantly, in traditional Chinese medicine, there was a wide range of uses that were well documented, and they are believed to be the elixir of life. Now, since then, it's been a huge gap between science and medicine. They were commonly utilized back then with little science. Ironically, now we've seen a reverse. We see lots of science. Very recently, there's been a meta-analysis showing just overall mushroom consumption lowers overall rate of cancer. We see meta-analysis showing that certain mushrooms can help lower blood glucose levels. Certain reviews have shown that mushrooms can improve immune system, despite the confusing title. And even maitake can induce ovulation in women that can't ovulate because of polycystic ovarian syndrome. And these are just a few of the uses that have come out recently within the last 5 to 10 years. But when we go and look at the actual products in the market, we specifically see there's 3 types of products. At the top, products for your immune system. At the bottom left, products that is for your brain function and support. And at the bottom right, products that are specifically have no medicinal stated benefits or claims. They're just a generic mushroom extract, and sometimes they're combinations of these different mushroom extracts. So we utilize multiple different mushrooms, which each have their own metabolic profile. This includes beta-glucans and different secondary metabolites. But these are actually locked inside of fungal cells. So you can actually see here at the very right, inside of the cell walls of most fungi has a compound known as chitin. This is indigestible for humans. Because of this, if you were to consume whole mushrooms, you don't actually get the same medicinal benefits because those metabolites are locked inside of the cells. You have to first extract it before you consume it to get those medicinal benefits. Now, not all extraction processes are the same. If you were to imagine this as a metabolic profile of a mushroom, the typical methods start with water extraction. This gets the hydrophilic fractions. There's also alcoholic extractions, which gets lipophilic compounds from the metabolic profile. And then there's the commonly utilized dual extraction process. This is most common currently in industry, and it's just a combination of the two. The problem is that they don't have the highest yields and they don't get the entire metabolic profile. And specific fractions are beneficial for medicinal health. So for example, if we wanted to get and make a product that is really good for diabetics, we would take the anti-diabetic fraction that's beneficial, and we would turn it into a product like we have, which we call glucoshroom. So how do we do this? Well, for IP considerations, we can't get into too much details, but we use what's called targeted extraction. This is common methods that are utilized in a lot of different labs at universities and in research institutions. For example, cultivation is commonly utilized in biology labs, and purification in just about every biochemistry lab. We also utilize state-of-the-art techniques like new extraction methods, as well as things like pre-treating our mushrooms and fractionation. And the whole point is to get targeted metabolic profiles and extracts that we can then use, which are much more effective than competitors. And the reason why that's so important is that currently, if you were to utilize mushroom extracts, you would have to have hundreds of grams of these mushroom extracts to get those benefits, whereas we can actually dial it in and bring it down to essentially 1 or 2 capsules a day instead of that hundreds of grams that you would have to consume. So I'm now going to pass it over to the future MDs.
So mushroom extracts can be simplified into 2 main mechanisms of action. First, indirectly, mushroom extracts act by acting on the microbiome as a prebiotic, which is similar to probiotics but are not living organisms. They can also act directly through bioactive compounds, primarily secondary metabolites, that can be absorbed into the systematic circulation and act directly on various tissues. We wanted to focus on obesity because currently it is a worldwide epidemic. There are over 2 billion people that are overweight and about 1 billion people that are obese worldwide. The average medical costs increased by approximately 30% for overweight individuals, and people who are overweight have increased odds of type 2 diabetes and metabolic syndrome. They also have increased relative rates of stroke, congenital heart failure, sudden cardiac death, and chronic kidney disease. And 12% of all cancers have a burden attributed to obesity. One of the areas we wanted to focus on was cordyceps. This is a great example of what we do in our company. Cordyceps are grown on a rice medium that we enrich with selenium to optimize the metabolic profile. Using a crude extract from selenium-grown cordyceps resulted in significantly lower tissue fat, hyperlipidemia, appetite, adipocyte, and colon inflammation, as well as gut microbiome dysbiosis, while also increasing thermogenesis. This study was done in mice and showed promising effects. However, we are focusing on humans and want to see promising clinical data to back up the animal data. In a randomized clinical trial, Pleuridis significantly decreases hunger as soon as 1 hour after consuming an enriched meal that was calorically consistent with similar macronutrients. Consistent with these results, GLP-1 was significantly higher in the enriched meal. Another study also showed that ghrelin was decreased with Pleuridis enrichment. Our aid to weight loss is a product called Slim Shroom. This product is made by focusing on extracting the secondary metabolites of both Pleuridis and cordyceps and combining them together. We recommend taking it 3 times per day with each meal to help you decrease your hunger, increase GLP-1, and decrease ghrelin. GLP-1 specifically acts on the stomach, pancreas, and brain to delay digestion and decrease food intake. Ghrelin is one of the major hunger hormones. By decreasing ghrelin, we can move from the left to the right and change from hunger to satiety. As a result, people eat less food and will lose weight.
Switching gears a little to diabetes, specifically type 2 diabetes, which involves insulin resistance leading to high glucose levels. We can see this on blood tests through fasting blood glucose of over 7, 2-hour oral glucose tolerance test of over 11.1, and HA1C of over 6.5%. Type 2 diabetes affects 537 million adults all over the world, and it comprises of about 90 to 95% of all diabetic cases. Each year, 10% of pre-diabetics are expected to progress to diabetes. Complications involve heart disease, heart attack, stroke, nerve damage such as retinopathy and neuropathy, autoimmune diseases as it's linked to celiac disease, and it's also expected to affect fetal development in pregnant moms. One mushroom we're looking at is reishi, and in animal studies, it's been shown to improve insulin resistance. Insulin resistance here is measured by HOMA-IR, or homeostatic model assessment of insulin resistance, and it's a simple, non-invasive, and translatable measure of insulin resistance. So for this study, they had normal control mice as well as diabetic mice separated into diabetic control, high dose, and low dose treatment groups. We can see that insulin resistance is higher in diabetic control mice and returns to near baseline in treatment groups. And then Alyssa covered it previously, but human microbiome consists of bacteroids and firmicutes, and this ratio is usually disturbed with disease presentation. So in diabetic control mice, you can see that this ratio is decreased compared to normal control, and microbiome is restored with treatment of this mushroom extract. In human studies, reishi has also been shown to improve insulin resistance. So here's a study where they had participants take 12 weeks of either control placebo or 12 weeks of the mushroom extract. And here we can see that insulin resistance increased in the control group and was maintained and even decrease a little with the mushroom extract treatment. Another mushroom we're looking at is poria, and this is a large meta-analysis of over 70 RCTs showing that poria inhibits hyperglycemia pretty much across the board. So patients here are on diabetic management, and they are either taking poria on top of their management or they're taking a placebo. And it's shown that with poria supplementation, there is a decrease in fasting blood glucose, 2-hour postprandial blood glucose, and HA1C. And so our aid for diabetes is Myco's glucose shroom. And we recommend that we take 1 tab per day. And it's shown to improve gut microbiome, decrease insulin resistance, and decrease blood glucose level through this modulation of the gut microbiome.
Is there anything more embarrassing than erectile dysfunction? I think 12 million US men would probably agree with me. Some of the risk factors include age, obesity, diabetes, heart disease, trauma, drug abuse, and depression. But the two main ones are really age and diabetes, which is why we're focusing on those two. So we've been utilizing cordyceps because this is shown to increase blood flow. You can see here at the top left in normal control, the intracavernosal pressure is significantly lower compared in the diabetic group compared to the normal control. It's about half the mean arterial pressure. When we give it a cordyceps extract, you can see it's actually significantly higher and it goes above the normal control levels. Similar results were seen in higher doses, and when we compare this to sildenafil, which is Viagra, you actually see it's not nearly as effective. Sildenafil is not nearly as effective. Cordyceps goes above the control, whereas sildenafil does not actually get there. When we try to figure out why, we can actually see that this is due to nitric oxide synthase activity. We can see here that the diabetic group increases the nitric oxide synthase activity. So does sildenafil, but we see at the medium dose, it's a much higher amount and similar to the control compared to diabetes. Interestingly, cordyceps also increases sperm count and it increases sperm motility. And we see this generally across all 3 of the doses, specifically at the lower to medium doses here. And this is something that sildenafil does not do. This is once again in our diabetic model that we have. Now, this is generally for people that have diabetes-induced erectile dysfunction, but there's also age-induced erectile dysfunction. So because of this, we've also looked at reishi, and we specifically see here after 2 months of supplementation, this can increase testosterone levels, and by 5 months, it significantly increases it by about 100 picograms per milliliter. So it's quite a large amount increase in testosterone levels. Now, it's also important to note that it increases mating. So you can see here on the left, it decreases the time before mating after introducing a female, and it also increases the number of matings for every 20 minutes. And so what we've been focused on is taking these 2 mushroom extracts, combining them together in our product called Sexy Shroom. And we recommend taking this once a day to increase your testosterone. It will increase penile blood flow, libido, sperm count, and sperm motility. Now, the mechanism of action isn't quite elucidated, but we do know nitric oxide synthase plays a large role in this. And so for those that don't know, nitric oxide synthase found in the endothelial cells will produce nitric oxide and will activate soluble guanyl cyclase to produce cyclic GMP, which then induces relaxation through dephosphorylation of the myosin light chain. Sildenafil or Viagra acts a very similar way, except with mushroom extracts, we can increase this whole process, the whole pathway, whereas phosphodiesterase 5 inhibitors like Viagra will just extend the effect of cyclic GMP being there. So this is very important that we can close the science medicine gap that currently is seen with tons of research out there showing the benefits. And it's quite important to note that this has been seen essentially effective in all age group, genders, and ethnicities in the clinical trials that have been studied. There doesn't appear to be a bias. You can also get these over the counter as nutraceuticals. This enables patient autonomy, which is extremely important for erectile dysfunction products, as well as quick and inexpensive access to solutions. This is important for products like obesity and pre-diabetic products, because quite often it's recommended for lifestyle changes, and generally this just doesn't work very well. With no major side effects, this can really help prevent disease progression. We'd be happy to answer any other questions that people have. Thanks so much for listening.
Awesome, thanks so much. So Dr. Lewis, go ahead. I see your on.
Yeah, that was really super interesting. So I guess my first question is, how are you going to avoid the zombie apocalypse?
Yeah, it's a great question. Show us a zombie, we will give you your money back.
Okay, so my real question is, given this is a nutraceutical, what regulatory environment are you working under, and how does this affect what kind of claims you can make on your labels?
Sure, that's a great question. We have to get a certificate of analysis for any product that we're going to produce, showing that the compounds are there. We plan on starting going to the US just because it is a simpler and quicker path to market. We are going to make all of our claims structure and function claims, so that way we can actually just show them the data if they have questions. It doesn't require pre-approval like it does here with Health Canada. We do actually need to get some clinical data before we can come back to Health Canada and get them get them up and going here in Canada, because they are novel combinations. But we can already make the specific claims, and we have to go through the process, but we can make those claims. We just need actually toxicology data for our specific products that we can get from the FDA.
Great, thank you.
So what I understand, Greg, is that mushrooms can solve everything based on your talk in a way. Is that claim correct?
I would not say it solves everything. It's definitely something that we can use to improve people's lives. And it's something that I think we can really use to augment typical cases where we would say use lifestyle changes and we don't actually prescribe drugs. In those cases, we always see that in the majority of them, it still leads to disease progression. And this is something that can help delay that. And when we look at the data, specifically for diabetes, it just delays the onset and it helps improve quality of life. Is it going to solve diabetes? Is it going to solve obesity? Of course not, but it is something that can greatly help patients, and it enables them to take that into their own hands.
And so those papers, the data that your group has shown on mating and other mice studies, was this something that you guys did the work on, or is it some research that was carried out by other researchers?
Yeah, so the majority of what we've based our initial research on is from the research that's already been published. So those ones were actually published by other researchers, and that's really guided us towards what compounds that we're looking at. We've been able to narrow it down basically through the majority of mouse and animal and cell research out there to figure out what compounds we need to focus on. A lot of our own data we haven't actually shown. It's more focusing on actually getting those compounds within the mushrooms extracts. But for IP considerations, we haven't shown that.
Thank you.
Just a couple, we have 2 more minutes if anyone has any other questions, so just wait a second.
Just one question, Dr. Triscott. Often there's drug-to-drug interactions, and how do you address that? And often pharmaceutical herbal medications are not all the standardized, it's not all the same. So how would you address that? And what sort of message would you give the public? Because the public really may not be scientifically knowledgeable on evidence-based.
Sure. Carol, do you want to answer that one, or do you want me to answer that one?
Sure, I can answer that one. So a lot of the mushrooms that we're looking at have been used in traditional Chinese medicine, and there hasn't been shown to have any drug interaction with this long history of use. That being said, there is a wide pharmaceutical window for these extracts, and so we're more focused on the lower end of it and don't expect to see any side effect as a result. And again, all the studies have shown no side effects or bias in terms of age or gender or ethnicity. And then, sorry, the second part of your question.
I think I can answer that one.
Yeah.
To answer that one, we would actually recommend people that are anorexic not to take a product, Slim Shroom. this would very likely not be helpful for them. It would probably cause things to be worse. And so we want to make sure that that's not the case and that we target the appropriate markets for that. And it's not like there's other products that people can take, like you start smoking, that can reduce your appetite as well. So it's just we have to do our due diligence to make sure it gets into the right hands. Another one, like don't take this and Viagra, don't take Sexy Shroom and Viagra because of the different but similar pathways and mechanism of action. That's probably would be very bad. And so we need to do our due diligence to make sure that it goes into the right people's hands and we educate them on what and how to use it.
Perfect. Okay.
Thank you.
Yeah, hopefully that answers the question, Dr. Triscott. So we'll move right along to the next group.